We're here today because we're passionate about what technology can do to help support health and care teams. The question of how technology can help put children and young people at the centre of their care is, of course, huge and not something we can cover thoroughly in 15 minutes. And I know that's something that everybody today is, really passionate about their area and could say so much more. And in our case, we know that can range from things like mobile health apps to remote consultations, digital care plans, to gamification, augmented communication, and creative expression, some of which we've obviously seen today in the videos, which have also been absolutely brilliant. Today, we'll focus on answering the question from our area of expertise, which comes from supporting mental health services for around 20 years. We support around 80 customers who work in mental health care for children and young people in particular, and that includes Barnardo's, Anna Freud, and NHS CAMS and mental health support teams up and down the country. And our digital technology helps them deliver timely, effective, and needs-led care. In the next 15 minutes, we'll give you a brief overview of who we are and what we do, and some examples of where technology is helping to put children and young people at the centre of their care. We'll also share links to resources we've generated and collated this year, thanks to some great collaborations with experts like Naomi, who we've worked with recently. So, Mayden's purpose is clear. It is about transforming health and care together. And that means together with our customers, their patients or service users, and the health and care ecosystem we are all part of. In the context of putting children and young people at the centre of their care, this is about harnessing technology to improve access to that care, co-create and design services with children and young people themselves, flow communication effectively and securely to those involved in the care of that child or young person, including the child or young person themselves. It's also about using technology to identify individual needs as early as possible and provide timely, evidence-based and needs-led support. We want those providing mental health care for children and young people to be able to focus on providing that care and not get caught up in time-consuming manual processes. We're conscious of the pressures that services are facing with increasing demand, but not necessarily increasing resources, and the expectations of delivering to the new NHS 10-year plan and both the opportunities and challenges that that could bring. Our technology delivers data-driven improvements for the benefit of services and patients. We know that services have an abundance of data, but the real challenge is understanding the stories that that data can tell. It's about addressing the challenges services face today and bridging the gap whilst redesigning for the future. We've been really fortunate to work with some services recently on exciting pathway redesign projects. And by working in partnership, we've been able to support them in addressing immediate pressures, such as where to allocate resources for the biggest population health impact, whilst building long-term solutions. And data is the key to unlocking all of that. But what about the role that Helen and I play in all of this? So our jobs are to champion the children and young people's mental health and neurodiversity at Mayden. We help our colleagues to understand the challenges in these areas so they can develop technology that's really going to help solve the problems our customers face in providing timely, evidence-based, co-created care for children and young people. So just a little bit more about our customers and the services that we provide them. So our customers are mental health care providers, neurodiversity services, addictions and healthy lifestyle providers across NHS, local authorities, private and charity sectors. And we help them work as effectively as possible by providing 3 tailored digital solutions designed to support seamless access to care. Our flagship product, IAPTUS, is a community and mental health clinical system used in over 200 organisations that support the care of over 10 million patients in the UK, Ireland, Australia and Canada. Backpack is an intuitive, secure and portable client management software for counsellors and psychological therapists in private practice. And Theseus is a flexible case management system for healthy lifestyles and addiction services. And Theseus is trusted by over 200 organisations in the UK, supporting the care of over 1 million people. And we're known for exceptional customer service. We collaborate with our customers, and we could not do what we do without their input and incredibly valuable feedback. And we design the solutions that support them as they grow and scale. And ultimately, our technology empowers people seeking support to receive the high quality and compassionate care they deserve when they are at their most vulnerable. So at the heart of IAPTUS is a flexible and customizable care pathway. The key to this, every person accessing care is visible in terms of where they are in their journey, how long they've been waiting, and what the next steps are. This means that no one gets lost in the system or can fall off the bottom of the spreadsheet. Because the care pathway is customizable, service providers can design the care around the child or young person. And because it is also designed for consistent data collection, it's easy for services to see what's working and what's not, both in relation to service efficiency and effectiveness, and also outcomes for the child or young person. This granular level of data means incredible insights are generated that services can use to inform equity of access and easily spot bottlenecks and adapt their services as they evolve and grow. The IAPTUS care pathway is an example of how technology is helping to deliver care efficiently and effectively, but also at scale in ways that support fair and equitable access and collaboration between teams, multiple teams, and multidisciplinary teams who are often involved when it comes to providing services for children and young people. It forms the backbone of the IAPTUS system and is a unique technology that experts in the field of children and young people mental health and neurodiversity tell us is second to none for meeting the increasing demands on already busy services. IAPTUS is used by providers that run single points of access and getting help services to enable to identify need, triage, and have relevant referral routes for signposting. This can help, for example, with ensuring those with neurodivergent needs can be clearly identified as early as possible and services can offer appropriate support. One example of a customer doing this is South Tyneside and Sunderland NHS Trust, who use IAPTUS in community mental health services for children and young people. They have a single point of access where they triage all referrals, both from GPs and self-referrals from children and young people and their parents and carers. They use an assessment process in partnership with other agencies, particularly schools, to identify areas of concern and agree on the type of support that best suits individual preferences. They have a neurodiversity pathway within their mental health services, which they manage in IAPTUS. They also offer neurodiversity assessment for specific conditions, but they understand that assessment and even diagnosis doesn't provide all the answers and support that families need, so they refer or signpost to other local services and organisations that provide support where appropriate. So Northpoint is another IAPTUS customer that provides talking and digital therapies to children and young people across Yorkshire and surrounding areas. Northpoint is commissioned by the local ICB, that's Integrated Care Board, to deliver mental health and first point of access services for autism and ADHD. They use IAPTUS in mental health pathways to manage referrals and care pathway management to improve patient journeys. They offer digital therapies with referral and management via IAPTUS, where clinicians feel it is appropriate, to teens and their parents and carers who would benefit from support for anxiety. Northpoint is also exploring how they could integrate digital innovations into neurodiversity pathways, such as tools for profiling and needs-based support, particularly in ADHD and autism. The communication tools that Northpoint use include SMS text messages, online self-referrals, and electronic letters to GPs and patients. So when it is well designed with and for children and young people and those involved in their care and effectively used, technology supports putting the child and young person at the centre of their care, like at South Tyneside and Northpoint. But of course, there is always more to be done. Whilst we pride ourselves on providing digital solutions that support care to be equitable, effective, evidence-based, needs-led and efficient, we are working together with practitioners, leading-edge researchers and children and young people themselves to continue to develop technology that ensures care is also strength-based, neuro-affirming and adapted where appropriate. We recently hosted a webinar where we heard from neurodivergent therapist Helen on how to empower neurodivergent clients through sensory-informed care. We will be working with our customers in the future to see how what we can learn can be incorporated into the technology in the future. As well as already working with anxiety and depression in young people's clinics at the universities of Reading and Oxford, IAPTUS is about to be adopted by the University of Bath Mental Health Research Group as part of an £11 million funded NIHR project to help improve understanding, awareness and treatment for mental health difficulties in children and young people who have conditions such as autism and ADHD in the Bath, North East Somerset, Swindon and Wiltshire areas. They will pilot new treatments and develop more suitable, valid outcome measures. Designed with customer feedback, we believe that technology should allow health and care providers to connect seamlessly with patients, family members, carers or other professionals to make sure the right information reaches the right people at the right time. We also believe that technology can help with support whilst waiting for therapy or whilst waiting for assessment and diagnosis for autism and ADHD, for example, and that this support should be personalised and tailored. We've been working with Dorset Healthcare NHS Foundation Trust to explore how digital tools could help with this very early stage of support and intervention in areas such as social communication, sensory experiences, emotional awareness and regulation, and how those identified needs could be matched to statutory lists held by local authorities for speedy access to appropriate resources. These are all examples of customers and partners we work with in children and young people's mental health. As you can see, they span NHS, private and academic organisations. Each of them is playing their part to transform the health and care of children and young people and using technologies in tailored ways to make sure children and young people are at the centre of their care. It's very important to us at Mayden that we work together with others in the healthcare ecosystem and that ultimately those we work with are providing tech for good. We're an active member of something called Interopen and the Tech UK Health and Tech Community, and we proudly support initiatives that make tech more inclusive, ethical and impactful. From championing neurodiversity through the Tech Talent Charter and One Health Tech to tackling digital poverty with the Bath Digital Divide Collective, we're committed to using technology for good. Ultimately, the way technology can put children and young people at the centre of their care is enabling healthcare professionals to do what they do best, to help them be as efficient as possible, to reduce admin burden and to spend their time doing what healthcare professionals were trained to do, care and spend time with people in their care. It also means using technology to help care and treatment be effective and evidence-based. This means enabling the ethical and safe collection of robust, reliable data to support learning for the future. And finally, technology should be used to help personalise care through co-creation to allow for flexible approaches and adapted support that is still evidence-based, which can incorporate technology-enabled care where appropriate. We've been speaking with many people with extraordinary expertise in this area about how they think technology can help children and young people's mental health and neurodiversity services this year and have collated their reflections in a thought leadership series on our website. We'd love for as many people as possible to see these and for them to spark conversations and connect people with one another and be a catalyst for change in the provision of mental health services for children and young people. There's a QR code on this slide to access the resources. You might be able to capture that now, and we're very happy to share these slides after if helpful. And also, we've recorded an interview with Naomi on understanding the complexities of neurodiversity in children and young people's mental health earlier this year. It was such a valuable conversation and we thank you so much for your time in that. We learned so much and there's links to that on our website as well. And then finally, our next webinar is coming up in a couple of weeks, where we have a panel of experts who will be discussing how to continuing this conversation of how to put children and young people at the centre of their care in mental health and neurodiversity services. And we'd love for you to join us if you can. And thank you so much for listening. Please feel free to get in touch. Our details are here and all the resources are on the Mayden website if the QR codes are not working for you.